Good morning to those of you who are joining from India. Good afternoon for people joining from Australia. And good evening for those of you joining from the US and Canada. Wherever you're joining from, welcome to today's webinar. My name is Praveen Nara. I'm an event coordinator for CWC and Thai Global. I'm the founder and CEO of TechDatas, and I'm super excited to have you on this webinar tonight. We have two utmost speakers in the field of brain health. Dr. Raj Gupta, a neurologist and president medical staff at Regional Medical Center of San Jose, and we have Dr. Fred Travis, director of Brain Center at Maharishi University of Management. On this webinar, you will learn simple yet seldom used techniques that nourish your brain and keep it healthy. You will also learn how to keep yourself away from Alzheimer's, dementia, and constantly recharge your brain. So I would like to invite Mahavir Sharma to kick off this webinar. Mahavir Sharma is a serial entrepreneur, and he is the chairman of Thai Global. He currently holds many key positions, including chairman of Thai Global Board of Trustees. He's a co-founder and chairman of RAI, Rajasthan Angel Innovator Network. He's also chairman of Thai India Angels, an initiative by Thai Global, among many others. I now invite Mahavir to say a few words.
Such a great journey, great pleasure in partnering with ICC, Crack the Wellness Code. Every last Sunday morning in India, I really enjoy learning and educating myself on a series of things. I look forward to the talk. Thank you.
Thank you so much, Mahavir. Now, let me introduce Raj Gupta. Dr. Raj Gupta is a neurologist, and he's a president medical staff at Regional Medical Center of San Jose. And Dr. Gupta practices two mantras, and the first one I really like. It's Medicine Dilse, D-I-L-S-E. That stands for D for dignity, I for integrity, L loyalty, S smile, and E enthusiasm. And his second mantra is say no to nonsense medicine. Dr. Gupta has board certifications in neurology, clinical neurophysiology, and sleep medicine. His areas of expertise include adult epilepsy, stroke, critical care neurology, general neurology, as well as sleep disorders. Raj, thank you so much for giving us your valuable time and sharing your knowledge with our audience.
Thank you, Praveen, for a nice introduction. Again, my name is Raj Gupta. I live in Fremont, and I welcome all of you from all over the world. I try to make it very easy to understand slides, and I hope we learn something from it. So the topic given to me was brain health, and before starting the brain health, I wanted to talk more about brain. You know, the brain is about 3.3 pounds. It's make up about 2% of the body weight, and it contains about 86 billion cells. So you can imagine how many cells it has called neurons, 86 billions. It has gray matter, and then we got a white matter, which has synapses, which are multiple times than your gray matter. So we got a lot of cells there. Now, if you look at the brain, there are four main lobes. So red is the frontal lobe. It is important for problem solving, emotional trails, reasoning, speaking, voluntary motor activity. Then you got parietal lobe. It helps you to knowing right from left. All the sensory stuff goes there, reading and body orientation. Then you got an occipital lobe, which is important for vision and color perception. And most important thing for memory is temporal lobe, which helps with understanding language, behavior, memory, and hearing. And then we got this something called brainstem, which connects brain with the spinal cord. And it has very vital structures which control your breathing, body temperature, digestion, alertness, and swallowing. Now, before I wanted to touch on the brain prevention, we need to know what are the diseases we are dealing with the most. So if you look at the annual incidence, and this is the whole pie, 51% is stroke. So half of the brain pathology comes from strokes in adults. And then 21.4 from dementia or Alzheimer's. So another 1/4, and the other quarter, it is epilepsy and Parkinson's disease, traumatic brain injury, MS, ALS, HIV. So when we need to do prevention, we need to know which are the diseases we are most likely to encounter. So most common neurological disease what we encounter is stroke. And this is the second leading cause of the death worldwide, fifth leading cause of death in the United States, third leading cause of disability adjusted life years lost. Someone in the US has a stroke every 40 seconds. And there is a $40 $40 billion direct and indirect cost in 2014. So it's very, very common disease, very prevalent. Now, what is the definition of the stroke? It is a sudden event that occurs when blood vessels that take blood, oxygen, and nutrients to part of the brain is either blocked or burst. So when it's blocked, we call ischemic stroke. And when it bursts, we call it hemorrhagic stroke. And if you see in this slide, this is the brain with all the blood vessels. And this dark area is where ischemic stroke happened. And this area, the more brighter, this is the bleed. So, and this is also bleed. This is also bleed. So again, majority of the stroke, they are ischemic, but about 15% they are bleeds. So here is the incidence. 88% of all stroke are ischemic due to blockage of the arteries. And then about 15% intracranial hemorrhage or subarachnoid hemorrhage or other type of hemorrhages. So how to recognize a stroke? We teach all our patients, they need to remember this mnemonic fast. F stands for face. So you smile, and when you smile, your face is symmetrically elevated. If one side does not elevate, that's what we call facial asymmetry. Then you ask patient to raise both arms. A stand for arms, and one does not raise, another raise, that's arm. And then speech, it can be slurred or there can be understanding issue. And when you have these symptoms of these fast, face, arms, speech, and time, do not call doctor's office. Please call the 911. Time is the essence because there are many, many therapeutic medications which are very time sensitive. So let's go to know prevention. How do we prevent stroke? I think that's our topic. So there are two types of risk factors. One is non-modifiable, which we don't have any control, like age. Most of the strokes occurs after 65, or gender. There's gender disparity. There's a race and ethnicity disparity. Typically Black and Hispanic have more strokes than Caucasians. And then there are families who have strokes. So this we cannot touch. Now the next slide, this is very important. So if you see here, there are about 10 risk factors which we can modify. And this number 8, blood pressure, diabetes, high cholesterol, smoking, obesity, medication, heart disease, physical inactivity, stress, alcohol. Okay, so how do we know which one is the most important thing to control? There's too many things, right? So there was an answer to that study. So this study was published in Lancet in 2016. And it was carried out in 32 countries worldwide from Canada, also from US, Australia, and Asia. And they got all the data of about 26,000 patients. And they went by this patient-associated risk. Now they said, if we can control these 10 risk factors, okay, we can reduce the incidence of stroke by 90%. So 90% reduce risk by controlling these 10 risk factors. Now, out of these 10, which one carry the most weight? If you look at hypertension, if we control the hypertension, we can reduce by 48%. So half of the reduction comes from just high blood pressure. So I will emphasize again on hypertension. That is the most thing you need to control to prevent stroke. No doubt about it. Okay. Now, the regular physical activity, again, 36% reduction in strokes. if you do at least 30 minutes of moderate brisk exercises, 27 if you control your lipids, the diet 23%, again obesity 19%, and then stressors 17%, smoking if you quit smoking 12%, and then cardiac disease and alcohol and diabetes. So again, this helps us to focus which are the most important things to look forward to. Now, same thing, there was another study which was published in 2008 in Circulation, and this study was done by the Harvard. And if you see, there were 43,000 men and 71,000 women, and mostly these were health professionals, either nurses or allied health professional, and they just looked at 5 lifestyle factors: not smoking, healthy diet, at least 30 minutes per day of moderate or vigorous physical activity, optimal weight, which was BMI less than 25, and 1 alcoholic drink per day for women and 1 to 2 for men. So 5 factors. And then they followed this patient almost 20 years, which is to prevent the stroke. And if you see these all volunteers, if they control all those 5 healthy lifestyles, their risk was reduced by 81% in women, and in men, it was reduced by 80%. So that's a huge reduction. Imagine out of 100 patients, you got only 20 patients left to take care in the hospitals. So 80% we can deal as outpatient. We can prevent primary prevention. So as I said, the main goal should be controlling the hypertension. And if you look at our American diet, yeah, average is 3,400 milligram per day. And there has been proven again and again, we need to go around 2,000 milligram. Even American Heart Association, they recommend 1,500 milligram per day for everyone. And if you see 1 teaspoonful, it has 2,300 milligram. So be aware of the salt. I think, as I said before, 50% of the stroke you can prevent just by controlling hypertension, and the salt is the main culprit among others in the hypertension. There are a few diets which have been proven scientifically to help. The Mediterranean diet and also DASH. So if you Google, you'll find all the protocols. How can you incorporate in your lifestyle? Now, I will go again into same risk factors we already talked about. High blood pressure, most important. It causes atherosclerosis and also cardiovascular mortality. Now, before we used to go up to 140 systolic, the latest understanding is we want to go around 110, 120 systolic blood pressure. So if we can maintain around that, that'll be great help. Now, smoking. Again, smoking also causes carbon monoxide and nicotine. They reduce the amount of oxygen in the blood, but also damage the blood vessels. And the relative risk of stroke is about 2.5 times than non-smoker. So I would strongly suggest anybody who's smoking seek professional help. And the only one treatment what we know is quit now. Now, if you have stopped smoking for about 5 years, your risk goes probably close to 0. So I think 5 years is where you need to be very strong, and then it continues, could benefit. Diabetes, again, same thing. We want to keep it very well controlled. And it's not only the risk factor for stroke, also for the heart. And for example, if you see aspirin, which works very well for in other conditions, but if you have diabetes, its efficacy is reduced in preventing heart attack and strokes. So typically we ask you to keep hemoglobin 1AC less than 7. Some physicians, they even go 6.5 or less. The next category is carotid or other major artery diseases like carotid stenosis. Now, if you have narrowing up to 50%, it's fine. 50 to 69%, you worry a little bit. 69 to 90%, we really work on getting your risk factors controlled. And more than 90%, most of the time you have to go for surgery. So again, if we identify any carotid or other major artery disease, we need to focus on treating it. And another cardiac issue is atrial fibrillation, very, very common disorder. And if you have an Apple Watch these days, you can press the finger and it will record your heart rhythm and you can know you have atrial fibrillation or not. What we have seen in some of the studies, even 40% of the patients whom we cannot identify any cause for stroke, they have underlying atrial fibrillation. It's an irregular rhythm of the heart. It creates a clots which go to the brain and can cause stroke. Now, most of the patients, if they have atrial fibrillation, we can put them on very safer medication called Coumadin, which was old, but the newer one, they are really, really good and with very little side effects. So other conditions which can cause stroke, mechanical valves, another blood disorder, excessive alcohol use, illegal drugs. Many times when I'm on call, people who use cocaine or any speed drugs, they come with either hemorrhagic or ischemic strokes. Another one risk factor is high cholesterol. We really work with the patient and keep the total cholesterol less than 200 and LDL less than 100. And the next risk factor is physical inactivity and obesity. So as I mentioned before, aim should be BMI less than 25, and then activity at least 30 minutes, moderate, vigorous exercise every day. Now, the last thing for stroke is sleep apnea. So if you look at the literature, sleep apnea increases stroke rate by 2 to 5-fold. And up to 70% of the patient with stroke have sleep apnea. So what are the things you ask to the patient? Typically, they have difficulty falling or maintaining sleep. They can wake up 2, 3, 4 times a night. And then they snore. And that's one of the cardinal symptoms. No, I do have some patients who don't snore. So snoring is cardinal symptom. And snoring can be mild, moderate, or severe. Mild is very, moderate is if it affects the sleep of your bed partner. And the severe is the person in the other room will also hear it. So if you have loud snoring and also difficulty falling or maintaining sleep, dry mouth, increased frequency of urination, when you wake up, you feel tired, you feel sleepy during the daytime. These are all relevant questions. And by just questionnaire, 80% of the patient, we can tease out whether they have sleep apnea or not. Although the diagnosis does require a sleep study. And when we treat them, we can reduce their chance of next stroke and heart rate substantially. I'm going to focus on now dementia. Dementia, as you know, it's an umbrella term for loss of memory and other thinking abilities. And it has to be severe enough to interfere with daily life. And majority of the dementia, you see, is Alzheimer's, 60 to 80%, but there are other types of dementia too. So not only the Alzheimer. You can have Lewy body dementia, 5 to 10%, vascular dementia due to strokes, frontotemporal dementia, 5 to 10%, and the other types, Parkinson dementia, Huntington, rapidly progressive dementias. And sometimes you can have multiple pathologies, what we call mixed dementia. So the question comes, what is dementia and what is normal aging? And we all age and we do have a little bit of memory loss. That's not dementia. So in a typical aging, patient complains about memory loss, but able to provide detailed examples of forgetfulness. I forget that, but I forgot that thing, right? Occasionally searches for words. May have to pause to remember directions, but does not get lost in the familiar places. Yeah, as compared to the dementia patient, they get lost in familiar places and take excessive time to return home. Remember recent important events. Conversations are not impaired. So if they're talking to somebody, they're not going to pause. Notable decline in memory for recent events and ability to converse. And some interpersonal social skills are at the same level as they have always been. So typical aging, you are most of the time independent and your judgment is preserved. As compared to dementia, you do lose your judgment and independent living. So this graph is very, very important to understand dementia. So this is the time in years, and this is your cognitive ability. And let's say we are here at 50 years, and as we get older, there comes preclinical state where it's a silent phase. For several years, brain changes without measurable symptoms. individual may notice some changes, but less detectable on tests. And a stage where the patient knows, but the doctor does not. So they keep on saying, I have memory loss and I do all the tests, everything coming normal. Then you go to a milder stage. It's called mild cognitive impairment. It lasts for a few years. You see this, right? And then cognitive changes are of concern to individual and family, so get little more pronounced. One or more cognitive domains impaired. So they have either trouble with the concentration, recall, visuospatial orientation, a lot of other cognitive abilities. But they have preserved activity of daily living. So this is a state, if you catch it early, we can put on some medication to delay the onset of the dementia. And then when the cognitive impairments severe enough to interfere the everyday abilities, that's what we call dementia. And it can go mild, moderate, severe, and severe. So it's a slow decline throughout the age. So as we know, our older population is growing, and red is 85 plus, the blue is 75 to 84, and then the gray is 65 to 74. And if you see in 2040, we expect a large 85 plus. So our older patients, they're going to grow substantially. That is a projection. Now, if we tease out the Alzheimer dementia, which is the most common, what are the ages where we are seeing the patients right now? So 3%, about 0.2 million, less than 65. So this very small pie. Then some of them 65 to 74, 16%, right? But bigger pie, 75 to 84. And then another bigger pie, 85 plus. So as we cross 65, the chances of dementia keep on increasing exponentially. Now, what is the estimated lifetime risk for Alzheimer dementia by sex and at ages 45 and 65? So this is the age, and age 45, the men in orange, 10.3. The woman in purple, 19.5. And same thing on 65, when you go 11.6 and 21.1. So substantial risk. 1 in 4 person in this audience have the chances of getting a clinical dementia down the road. So how to beat it? Risk factors are almost same like stroke. Okay. So if you see the heart, you have to look for your heart. Any hypertension, diabetes, hypercholesterolemia, if need to be taken care, right? Be physically active. Same advice I gave for stroke. 30 minutes of vigorous exercise every day. No doubt about that. And it has to be aerobic, as Dr. Travis said. Follow a healthy diet. Same thing, absolutely. So remember, there's a dementia called vascular dementia and Alzheimer dementia. So you can have mixed of them. So you need to have, again, studies are not very definite, but there is some evidence that low sodium diet, including Mediterranean and DASH diets, they are good for dementia too. There's more and more growing. Enjoy social activity. So social interactions, very, very integral part. So whenever patient coming to me these days, I'm saying, it's hard to meet with the family, but what about video chat? The way we are doing with our patients, my 90% patient right now, I'm seeing through the video calls, not in person. And the next important thing is challenge your brain, means you need to do some memory exercising, like playing puzzles, chess, Sudoku. The memory is just like muscles, right? So more you use the brain, the more you get out of it. So to preserve what we have, patient has to work hard. So these are the very wonderful resources. Anybody who thinks they have dementia or their family members have dementia, I will strongly suggest go to alz.org. They have excellent source, all the symptoms, local chapters, lot of good research also helping, and then there are a few others. That's the end of my presentation.
Dr. Gupta, thank you so much for that wonderful presentation. We really appreciate it. Let's move on to Dr. Fred Travis. Dr. Travis received his master's and PhD in psychology from Maharishi University of Management, and he now works there as the director of Brain Center. He had a 2-year postdoctoral position at UC Davis and the VA Medical Center exploring brain changes during sleep. He's an utmost authority with over 30 years of experience in brain health, and he has authored 87 articles and book chapters that investigated the relationship between natural development and lifestyle choices on brain functioning. Dr. Travis also authored 4 books, and my favorite book being Your Brain is a River, Not a Rock. And you can buy it now on Kindle for just $3. So I would encourage you to do that. And Dr. Travis also has researched the effects of transcendental meditation practice on people with ADHD and post-traumatic stress. Without further ado, let me welcome Dr. Travis to speak.
Very much, Praveen. It's a pleasure to be here.
Thank
to
you.
speak at this conference. I'll be focusing on lifestyle practices. Now, why might lifestyle practices be important? It's because of the point you brought up. Experience changes your brain. When we have an experience, what it does, it creates a wave of electrical activity over the brain that lets us see what's there. But in that process, it changes the circuits that are being used. It's like water running down a rocky slope. As the water moves, it cuts its own grooves. Indeed, 70% of your brain connections change every day. What we see here, it's a cell, it's from a zebrafish. The square area that we see here in the middle is the cell body. This line going out towards the right is the output fiber. This is some of the white matter that Dr. Gupta was talking about. All these other lines are input fibers. Dendrites is what they're called. And on the input fibers, the dendrite, you see these little dots. These dots are synapses. So that's where another neuron is sending information to this neuron. So what the scientists did is they took a picture. First, they put phosphorescent dye in the cell, and then they took a picture every minute. We're going to see how this cell changes minute by minute. Here we go. Notice the dendrites, they're moving laterally. They're moving out. This again is minute by minute, a single cell. As you go in, notice how these synapses come and go. They're all gone, then they come back. This one here pretty much stays the whole time. This is what's happening in your brain. It's not a 0-1. It's not as though you lose things, but you're constantly amplifying your understanding or you're diminishing it. It's a very natural process. A very natural process which is determined by the decisions that we make. And that's how behavior can change the brain. That's how our decisions can change the brain. So let's look at some examples. Let's start with simple things like the water we drink. We lose 2.5 liters of water a day. You need to drink water because the water is a media that allows the brain to function. When you're dehydrated, you have problems with memory, with focusing, with conscious attention, and so on. The second thing is the food that you eat. Ayurveda suggests, in terms of body types, there's different food which is best for each body type. The reason that is important because the food that's suitable to our physiology when it gets into the digestive system, especially the gut, where the microbiota are there, there's 10 times the number of organisms in the gut as there are cells in the whole body. They're very, very, very tiny. They're very much dependent on the food and the quality of food and the type of food we have. They interact with the stress response, they affect immune functioning, fat deposit, and so on. Science is even calling this a second brain. It's a second brain that it's all of the interaction there is sending information up to the brain, and that's affecting how we see the world. That's affecting brain health. It's affecting inflammation. Sleep is important. And the reason sleep is important is during the day, we use and reuse neurotransmitters, proteins, and enzymes. We use them and then we recycle them. We use them and recycle them. So they break down. They get reused maybe 200,000 times a day. And they're just biochemicals and they break down. And what they create is what neuroscience is calling sleep dirt. It's like dirt, it's just metabolized, it's just sitting there. We make 7 grams of sleep dirt a day. 7 grams fills a heaping teaspoon. This is a result of a day's activity. Some of this is inert, some of it is beta amyloid, which is associated with Alzheimer's, also neurotoxic waste. So we need sleep. And what happens during sleep, it's really quite remarkable, and that is the structural cells that the neurons are sitting in, they're called astrocytes, almost like little round balls. They restrict and become smaller. It increases the space around the neuron 60%. 60%. What this does, it pulls the cerebral spinal fluid through the brain. It washes out the brain. It's called the lymphatic system. We don't have a lymph system in the brain as we do in the body, but these glial cells, these white blood cells, form these temporary tubes and allows the natural fluid to flow over the brain. So sleep is important. Well, first this is showing cerebral spinal fluid through the brain. On the left, dyed red is during sleep at night. And this is the deepest part of sleep, stage 3 and 4 sleep, when we're most rested. To the right, green, it's the movement of cerebral spinal fluid during the day. What happens if we don't get enough sleep? Well, we know, this is science has quantified it. X-axis is days of the week, it's 1 week. Y-axis is vigilance levels, how alert, how awake you are, how aware you are of things around you. The yellow squares are students that were randomly assigned to sleep 9 hours a night. Blue triangles, 7. Pluses are 5, red dots are 3. And what you see is immediate decrease in vigilance. It continues to go down as sleep is interrupted. What is happening is the sleep dirt is building up in the brain and it's just impeding natural functioning. So that's sleep. Exercise is important. When you exercise, you get more oxygen to the brain. Takes away waste. When you exercise, it generates brain cells in the memory system of the brain. It's called the hippocampus. It increases a factor, brain-derived neural growth factor, that allows you to put information into memory more easily. And the type of exercise that's good is called interval training. 2 minutes of warm-up, 20 seconds as fast, as intense. If you're walking for 2 minutes, run as fast as you can for 20 seconds, walk for 2 minutes, run again. What this does, it gradually increases workload on the muscles, on the cardiovascular system, and allows those systems to begin to optimize. 30 minutes a day of exercise is recommended, so 3 10-minute periods. Now, sleep and exercise are found to buffer onset of Alzheimer's. Dr. Gupta will be going into this in greater detail. Just like to bring up this research by Dale Bredesen. He models Alzheimer's as metabolic disruption. It's the sum of our lifestyle choices. It's the sum of our sleep. As sleep dirt goes up, cognitive functioning goes down. Exercise, how you use the mind, diet in terms of specific vitamins and so on. So this is important at all levels of life. Sleep and exercise, they optimize current circuits. The Vedic technologies help us develop new circuits, for instance, yoga asanas. In this research, students were involved in a yoga asana class. They were compared with students who did not take the yoga asana class. At our university, everyone practices transcendental meditation, so they were all transcending, but one group added yoga asanas. And we see after 1 month, greater happiness during the day. Also during the meditation experience, enhanced sense of personal self, transpersonal qualities. Meditations are important. And I'd just like to pause a moment because meditations are quite different. They are on a range of effort from low effort to high effort. For high effort, we have focused attention. Vipassana when you're focusing on the breath, Zen meditation, compassion meditation, Qigong, and so on. Whenever you focus the mind, you see this very fast brainwave. It's called gamma. It goes up and down 30 to 50 times per second. And in meditations that involve focusing, we see this brainwave. A second category is called open monitoring. In open monitoring, you watch what's going on in a dispassionate way, without judgment, without trying to fix. And mindfulness is in this, also non-directed meditation, Zazen. When you're just attending to what's going on inside, but not focusing your attention on one thing, you see a different brainwave. It's called theta. It goes up and down 5 to 8 times per second. These meditations are teaching you new ways to use your mind. They're teaching you cognitive tools to cope with the world after meditation. Third category, automatic self-transcending, is distinct in that it's not involved in thinking and doing and manipulating the mind, but it's involved in transcending. Going from mental thought to just mental silence, being inner wakefulness, awareness. In the Vedic tradition, it's called samadhi. It's called the experience of Atma. And these meditations need to be automatic, because if there's any manipulation of attention, the mind is not going to settle down. It's going to be caught up in activity. Now, transcendental meditation is in this category, and I'll be speaking a bit more about that. The brainwave is different. It's 8 to 10 cycles per second. And its purpose is different. The purpose is to experience inner being. To understand how these meditations interact, imagine you go into a kitchen. The chef says, okay, this is how to hold a knife. This is how to cut vegetables. You're learning how to use a knife. The chef will also teach you how to sharpen the knife. When you're sharpening a knife, you're not improving a specific task, but you're actually improving your ability to do all things because the knife is sharper. Automatic self-transcending is like that. It's not sharpening the knife, but it's clearing the mind. Consciousness, who we are, is more awake, more full. And what happens in the brain during this practice? To the left, blood flow during stress. These brains are looking to the right. Under stress, the front part of the brain, that's your executive centers, blood flow goes down. The red area, blood flow goes up. In the sensory area, you just get tunnel vision on what's immediately around you. When you finally get rest, we see blood flow decreases in all part of the brain. This is the brain removing sleep dirt. During transcendental meditation practice, it's a distinct experience called restful alertness. Notice it's the opposite of stress. Sensory areas, blood flow is lower. It's a state of mental and physical rest. But the executive frontal circuits, we see blood flow is higher. It's highly alert. We see this in terms of brain waves, coherence. Coherence is the relationship between different parts of the brain. In this slide, the top row, top of the head, bottom row is front of the head. Each column is a frequency band. Each dot is an electrode where we record brain waves. There's a line between the dots showing the degree of coherence. Notice gamma, there's very little coherence during transcending because this meditation isn't one of control. We see in alpha 1 that there's high levels of coherence as indicated by the darker line. This is coherence above 0.9. It's showing that the whole brain is being integrated into a larger interconnected circuit. And experience changes the brain. So what we see here is a 24-year meditator in activity and a 6-month meditator. Some have been practicing TM for 6 months or 24 years. Now they're in activity, their eyes are open, they're dealing with a task. The top one is a person meditating longer. Remember, experience changes the brain. What this person has done is by taking their brain to inner being, to inner silence, samadhi, many times a day, that quality of brain functioning is beginning to permeate behavior, thinking, action. What this leads to is able to deal with stress. You're not as overpowered by what's around you. because there's deep inner silence. At the same time, what's happening to the body when this is happening to the brain is the body's self-repair mechanisms are being improved. We find that transcending twice a day through transcendental meditation, hospital usage goes down 80%, goes down in all disease categories, because stress is a key component for most disease. And as we get more in the mind settled in being, we don't perceive situations as stressful. We're able to deal with them. Thank you very much. I'd like to stop there.
Thank you so much, Dr. Travis. This is really helpful. I am blown away that 70% of your brain connections change every day. And I thought that I heard reports that 0 to 5 years is when your brain synapses are formed the most. I bought multiple books on brain development when I had children, and I started researching that. My understanding or misunderstanding was that 0 to 5 years is like a window of opportunity, and if you miss that, you probably lost the opportunity, right? But what I'm hearing from you is if 70% of the brain is continuously evolving, there are things that we can do to control it. So is it true that we are the ones who are controlling our brain circuits with our own lifestyle choices?
Excellent question, Praveen. Yes is the big answer. A more detailed answer, you're right, between 0 and 5, the child makes 24 million new connections, new synapses every minute. So your kid's lying there. What are they doing? Oh, they're just lying there. They're making 24 million new brain connections every minute. And that's why you see this explosion of cognition and behavioral control. Those connections remain high from about 3 to 10, and then there's a process of synaptic pruning. As the connections you haven't used drop off, and then they reach a common point at about age 18. At the same time, different white matter tracks, connection between the brain is changing. The key point is this internally directed wave of maturation stops at age 25. From the first day of birth and throughout your whole life, experience is interacting with that. So yes, if the child doesn't get, for instance, hear language in the first 2 or 3 years of life, their language will be stilted, but it's not gone forever. After age 25, when this inner maturation waves have stopped, then it's your decisions, your choices for specific experiences, which are determining how you're modulating your brain. There should be a little disclaimer. If you listen to this talk tonight, your brain is going to change. It's true. It's happening wherever we put our attention. So yes, the early years are a time of great expansion. Yes, if they get rich experience then when they're making the connections, they start from a good place. But also, yes, you're in control. You're in control by the choices that you make. Choices that you make result in an experience. That experience, in turn, creates and sculpts your specific brain circuits. Thank you for that question, Praveen.
That's amazing. And you mentioned multiple kinds of meditation techniques. And the best one, at least for the purposes that you described, appears to be transcendental meditation. And it's been studied widely in reducing your diabetes, in reducing multiple diseases for you. And there are multiple people in our audiences who want to do transcendental meditation, but it appears to cost anywhere from $900 all the way to $2,000 or even higher. So are there cheaper alternatives for those who want to get started for free?
Talk to your TM center, and I don't know the situation in India, in Delhi, but I know in the United States, there's a number of well-wishers who have provided scholarships, because the people who need transcending most are the homeless, domestic abuse, veterans, PTSD. And so there's programs available for them so they can learn TM. The cost is just the business model to support the teacher so they can be there and give you a high quality product. It's not something you just go to the internet, read for 5 minutes, and it tells you to do some stuff. But it's a process of transcending. You actually need a teacher to take you through that process and you see how easily you can use the natural tendency of the mind to transcend. So you can look tm.org in either USA if you're out in California, or tm.org also in Delhi, and they can help you.
Awesome. And we have audiences both from Americas and India and Australia and multiple places. So yeah, definitely they can go to tm.org and find additional information. And
Yes, thank you.
I really like how you showed the difference between somebody who has been doing TM for 24 years versus somebody who just started and did 6 months. And that shows me that if you're able to help your children get started from early on in their life, they're going to be benefited more, especially in days of social media where people are being dumped with dopamine and all that, with games and several different ways, right? So what are your recommendations to get kids to start early while they're, really active?
Yeah, active kids love TM because it's a timeout that lets them be really successful once they go back into whatever they're doing. In the US, transcending is part of the school curriculum. So they come in, they meditate, and they do their studies, and they meditate, and they go home. It's best. So it's part of a structure that they have. And otherwise, if a child who is 10 years or older can learn TM, it's good to have a parent who's also meditating, so they can meditate with their child and answer any questions and so on. But the best thing is just put it into the social fabric that we have here. School teaches us how to focus and use the mind. Back to the analogy, how to use the knife, but it's not teaching us how to sharpen the knife. So you add transcending, and what it does, it makes everything more successful. And fundamentally, what it's doing, it's allowing the child to grow up and be happier, more self-assured, more strong within, so they can make the important decisions that they'll have to make in 10 years or 20 years.
So, Dr. Travis, let me ask you this question, and then I'll move to Dr. Gupta. What exercises are good for maintaining brain function? Weight exercises or aerobic exercises, or both?
Aerobic. You want to get oxygen to the brain. Strength training is important because what it does, it allows you to have the resources to carry the groceries home or move a couch or something. So that's important, but it's cardio which is critical. Because every time the heart beats to fuel the skeletal muscles, it goes up and brings oxygen to the brain. So when you're doing your cardio exercise, you're just bathing the brain in oxygen, you're taking away waste. You know how you feel after your exercise. You're just really, really awake. You're aware. Your thinking is focused and clear. It's so important for everyone. For students, they need to have that 30 minutes. For adults, for everyone 60 and over, you still need to exercise because the body is a vehicle that's taking us through this journey in life, and you need to keep it strong.
Awesome. Thank you for that, Dr. Travis. With that, so let me ask a few questions.
Sure.
You shared there are all these challenges with Alzheimer's, right? And one thing that is really surprising to me is at age 45, there is a risk of almost 20% for women and almost 11% for men, right? So what are the early signs of Alzheimer's that people should watch out for? And how is it diagnosed?
Yeah, so remember what I said, mild cognitive impairment. So you will have some memory lapses, forgetfulness, which is more than what usually people have in your surroundings. And it started affecting your functional activities. So then you go and seek the medical advice. Now, occasionally forgetting keys or names, or that's okay, as long as it's not affecting your day-to-day life. But always remember, most of the dementia start 65 plus. They're very, very low incidence of dementia before 65. But we do have some other tools these days. So let's say there is something called neuropsych evaluation. So if I do a quick memory testing in the office called Mini Mental, and they score 30 out of 30, but they still complain memory loss. Then we send them to a detailed neuropsych evaluation, which can take like 1 to 2 days, and it's very detailed, and they can tease it out whether is there any real memory loss or not. Now remember, memory is a very composite function, and there are a lot of other things which can affect your memory, including depression or psychological diseases, including your untreated sleep apnea, including your medications. So when you see a patient, you see as a whole and try to rule out any treatable causes. We also screen them for any metabolic reasons like vitamin B12 deficiency, thyroid, and other things.
Awesome. Thank you for that, Dr. Gupta. So I see a lot of questions here. The question is, why do women have higher risk than men, and how can women mitigate that risk?
So these are the hormonal differences between men and women, which causes little higher risk. And then as you go past menopause, the risk equalizes. So I think before menopause, you have a high risk. After menopause, it's almost same.
Got it. And the next question is, statins reduce LDL, but what is their impact on the possibility of a stroke?
Yeah, so it can substantially reduce your risk of getting a stroke. Again, it all depends on your baseline total cholesterol and LDL too. But even if you have normal LDL and total cholesterol, we still recommend to take a small dose of statin. Somehow it prevents atherosclerosis and clumping of the platelets together.
And the next question is, Dr. Gupta, to help reduce or slow down dementia, does it help to do activities that are low intensity, or would you recommend doing same activities but increasing intensity or difficulty of the activity?
So I assume we're talking about physical exercises. Is that right?
Yes, that's correct.
So, most of the time we tell aerobic exercises, that Dr. Travis said, where your heart rate goes up by at least 70, 80% of the baseline, and you stay there for at least 30 minutes, right? But some activity is better than nothing. So if they can't do the moderate, I would still say do the low activity. But we are so blessed these days, we all have these smart watches, smart tools, which we can pace on. So for example, when I'm doing my exercise, my baseline heart rate is around 60 or 70. I'm making sure it goes at least 110, 120 when I exercise, right? So you can, pace your exercises according to what heart rate you're getting.
And once we cross a certain limit, I heard that aerobic limit is somewhere, of course, it depends on the age, but somewhere like 120 to 140 for a middle-aged person. But if you go to 170, 180, then it becomes anaerobic, I think.
I wouldn't go there. I mean, it can be too stressful to the heart. And aim is to build up the endurance. Aim is not to cross all the limits, right? I mean, to me, 140, 150 should be the limit. I mean, unless until you are really very conditioned and you can handle it.
Got it. And is a 30-minute exercise, definitely that is what is recommended, right? So if somebody does it for an hour or even 1.5 hours, does it increase effectiveness? In other words, does it decrease the chance of getting all these diseases if they increase the exercise amount?
I mean, I think the physical fitness always help. So as much as you can do and as much as your body can handle it, we are okay with that. I wouldn't put any upper limit on it. There are people who spend like 6 hours walking every day at work, right? So yeah. It all depends on person to person.
Yeah, and there are some people who don't have time to work during weekdays, so they go for marathons or they go for 3 to 5 hour hike during weekends. So that still helps, in your opinion?
I mean, again, something is better than nothing, but recommendation is at least 5 times per week, moderate. So you can catch up, but it's just like sleep. You can't catch up what you lost because then your body was stressed next day, right?
Yeah. And my next question, and after this question, I'm going to switch to Dr. Travis with a few questions. So Dr. Gupta, how do you help patients who have early signs of Alzheimer's disease?
Sure. So again, first you need to define, are they early stage, moderate, or severe? So if it's a mild, most of the time we can put them on some of the medication which can slow down the progression. So there are something cholinesterase inhibitors like Aricept, or which you take once a day. Start with 5 milligram, and after 4 weeks make it 10 milligram. In the studies, it has been seen if you had to progress to, let's say, moderate to severe disease in 2-3 years, it may delay it to 5 or 10 years. So there's a definite clinical benefit in using them. And as if it progress, then we can add another medication. It's Memantine or Namenda, and then there are a few other medications. Now, we also look for any other causes which may be causing memory issues. Like each and every patient with dementia get evaluated for depression, very, very common, and also sleep apnea, and also metabolic causes.
Got it. Got it. Thank you. And Dr. Travis, the next question is for you from Mira. And it was definitely helpful to know about transcendental meditation. What do you think of the effect of other forms of meditations that you mentioned? Are they equally helpful or less helpful?
It's the difference between using the knife and sharpening the knife. So other meditations are teaching you specific ways to use your mind, to keep your mind on one experience, focused meditations, or to watch ongoing activity and not get involved in it, but just note, what is its effect on me? But those have their value, but they don't sharpen the knife. What they're not doing is they're not allowing your sense of self to become fuller and more expanded and more silent. So each meditation, they have different procedures, different brain patterns, and so they have different benefits. So it's not that one meditation is better than another, it's that each meditation will give you a specific range of benefits.
Got it. And next question is about Alzheimer's. Either of you can take it. Does vitamin B12 deficiency cause Alzheimer's?
I can take it. So this is one of the reversible causes of dementia. So every patient, when we see, we check the vitamin B12, as I said before also. And if the level is low, you have to supplement it. Vitamin B12 deficiency is very common in Indians, especially who are vegetarians. Most of the vitamin B12 is in animal proteins. So it's a good idea to get it checked if you have any memory loss.
Got it. Thank you. And next question is, again, either of you can take it. How much exercise does a 90-year-old person need, 90?
All depends. I knew an 85-year-old who was running marathons. I can't run a marathon. You want to have that exercise within your capability, which is going to allow you to increase your cardiovascular efficiency. So it could be different for each person. So, and this is where it's very great to meet with a physician like Dr. Gupta and just work through what is my upper level of exercise, how much I should do.
Yeah, I agree with Dr. Travis. I have some patients who are 100 plus, and they're living independently. Okay, there are patients 92, 95, you know. So there's no upper limit as long as your body keep on going.
Got it. Got it. And Dr. Gupta, next question is for you. A lot of people have diabetes, right? So when the sugar levels go up in their blood, how does it affect the heart health and brain health?
Yeah, so remember, the diabetes causes accelerated atherosclerosis. So it will narrow the blood vessels. So not enough blood goes to the brain. And the second effect I told you was it also decreases the effectiveness of antiplatelet drugs like aspirin. So both the mechanisms, and then diabetes has its own associated other things. So most of the time you have associated sleep apnea, you know, diabetic are more prone for it. They are obese. Then they have renal dysfunction. They have neuropathy. So it's a whole plethora of things which come in if you don't take care of your diabetes. I would strongly suggest anybody who's recently diagnosed, try to lose weight. I think that's the key if you are overweight or obese. Many times, if you lose 10% of your weight, your sugar may normalize.
Wow. Awesome. And the next question is, what's the difference between blood clots in legs versus brain? And can either one cause strokes?
Yeah.
Cause a stroke?
So the blood clot in legs, they are called deep vein thrombosis. And typically they occur due to inactivity or due to some blood disorders. Now, to go to the brain, there need to be a connection between left and right side of the brain. So if you have a PFO or any abnormal communication, yes, it can travel to the brain and cause stroke, but not normally. Normally, it will go to the lungs and cause more respiratory distress or respiratory failure, and then heart failure rather than the stroke.
And the next question, again, either of you can take this question. Are we predisposed for Alzheimer's?
On my side, I don't think so. If we use Dale Bredesen's idea that it's just a metabolic dysfunctioning due to our choices, and if we make the proper choices, as Dr. Gupta said, he has patients 100 years old. There's the choices they made for sleep, for exercise, for diet, for how they use their mind. So I think that Alzheimer's is preventable, and it's simply a lifestyle disease. It's something we bring on ourselves. That's why it's late. You don't see Alzheimer's in 20-year-olds or 25-year-olds and so on. That's my take on it. Dr. Gupta, I'd be interested.
So I fully agree with you. Majority of the patient with Alzheimer or the dementia is neurodegeneration. As we get older, we have deposits of amyloid and other abnormal proteins in the brain. But there are some genetic cases of all types of dementia, including Alzheimer. So if anybody in your family had memory loss in early age, let's say 20s or 30s or 40s, you should get checked out for genetic causes. That's the only, it's a whole blood panel which is done by genetic centers. Closest to us is Stanford, and they can tease out if you have any genetic mutation or some other reasons to have early onset of dementia.
Got it. And if you think about Indian diaspora, right, there are certain conditions that South Asians and Indians are more prone to. So in terms of brain health, what are those conditions that Indian generation should be more careful for because of their DNA and other limitations?
So what I see in my practice, the prevalence of hypertension, diabetes, and hypercholesterolemia, either due to diet or genetics or due to physical inactivity, very high as compared to other races. Also, lot of undiagnosed sleep apnea patients. So anybody who has uncontrolled hypertension, uncontrolled diabetes, high cholesterol, obese, sleep apnea symptoms, they should be checked promptly. You know, we should not depend upon advertisement on the radios, you know, if you're snoring, get it checked. No, we need to take proactive strategy and try to hit it before it becomes a bigger evil.
Got it. And the next question is, what is the recommendation for drinking milk and milk products?
I mean, I'm not sure. You have to go by USA guidelines for nutrition. And then there are certain servings of the milk products per day. I think it's 2 to 5. I don't recall on top of my head. But I don't recall there's any specific thing we need to drink so much of milk per day. It's all milk or milk products.
Got it. And Dr. Travis, the question for you is, are there some kinds of videos or something online, or do you have a video that you can share so that people can practice transcendental meditation?
Thank you for that question. Again, transcendental meditation is taught by a teacher. It's because it's not, I'll get into some psychological concepts. It's not didactic information, which is sit this way, have your back this way, do this with your mind. It's more procedural learning. It's more like riding a bike. And I have 3 daughters, and the way I taught them to ride the bike, I didn't have a PowerPoint. Took them down to a grassy field, and I took the handlebars and the seat and ran really fast. They got the experience of what it's like to ride a bike. It's similar to that with transcendental meditation, because what you're doing is a locus of control is becoming less sharp. What is happening is thinking and directing the mind is becoming secondary, and you're beginning to naturally experience that inner silence, which is the content for all experience. For that to happen, it has to go by itself. So this is why it's important to have a trained teacher. You can hear videos about the benefits people have had or about the research, what TM does to the brain, but to actually learn it, unfortunately, it needs a trained teacher.
Yeah, they say you can't learn how to swim at a seminar. So maybe transcendental meditation is like that.
Excellent example, exactly.
Yeah, awesome, awesome. And I know there's a lot of discussion about sleep apnea, and the question here is, how do you treat sleep apnea? But I would like to slightly alter the question. One of the challenges with sleep apnea is, you wear all these, heavy equipment like masks, which are very inconvenient. Are there easier ways to, number one, identify sleep apnea other than sleep study, where you need to go and sleep somewhere? Or is there an easier way to treat sleep apnea once you found you have one?
Sure. So there are 2 types of tests. No, you need a test to confirm the diagnosis, because many times I can tell you, I have been burnt. I knew this patient has sleep apnea, severe snoring. People have seen stop breathing. Do the test, it comes normal. Okay. So diagnosis of sleep apnea is a real objective diagnosis because the treatment is lifelong. Okay. Now the treatment options depends upon what's the degree of the sleep apnea. If it's a mild to moderate, besides CPAP, you have another option. That is something called oral device. So you go to a dentist, they can make a little device like a mouth retainer you put in the mouth. It brings your lower jaw forward. And as the lower jaw comes forward, your airway gets bigger at the back. Snoring disappear, very well proved. Another source can be if you are overweight, and I tell all my mild sleep apnea patients, you lose 10% of your weight. I'll redo the sleep study. There's a likelihood it may disappear. You must have seen people who are very severe obese. If they lose the weight, their diabetes disappear, their hypertension disappear, and their sleep apnea also disappear. And same goes to the mild to moderate obese patients too. So that's another thing. Now, in refractory cases, patient is not able to tolerate CPAP or oral device, and they have a severe sleep apnea. The other option is surgical. We can send you to the ENT doc, or which there are several types of surgeries these days, which can be done for the sleep apnea. Again, it's invasive, and there are some minimally invasive surgeries too, like laser assisted. So a lot of technologies there.
Awesome. I'd like to invite Naren Bakshi. He's the founder of CWC, and he has a question.
First of all, thank you very much. I'm a living case, doctors, of completely removing sleep apnea with weight loss. I'm also a living case for completely removing diabetes by losing weight. So what you have said is so true. I want to encourage, I've lost 35 kilos of weight and everything went away. So what we are talking about is doable. Now, question that I have for Dr. Travis is, there is a lot of debate, Dr. Travis, about Vipassana versus transcendental meditation still. And it comes because on one side, Vipassana people say, we don't charge any money, come. So they have their 10-day very intensive model. Then there is another one that transcendental meditation, and you of course taught to millions of people. So it's not something that has just arrived. So can you just put a little more light on it, because that question keeps on coming to me personally all the time.
Yes, so the question about money.
Money, and, is it a business? Is it, that kind of question keeps on coming.
It is a business in that it's surviving in the world, offering a service. And there's, in the United States, the David Lynch Foundation raises money, and then they have programs for people who are not able to afford. The money is there so that the teachers can be there, the trained teachers, because it's a little bit more teacher intensive than other meditations. In terms of Vipassana, Vipassana has many, many meditations over time. And over time, the process of focusing the mind can become automatic. So the Vipassana practitioner can experience inner being. It's after 30, 40 years of practice where you've made something automatic, which before was controlled. This is known in psychology. If you do anything enough number of times, it can become automatic. So in Vipassana, the 10-day retreats are very powerful in themselves, just being silent for 9 days, even if you didn't do any meditation. It gets us out of our mental chatter and our concepts and our categories and our worldview, and we can begin to reevaluate the world. So that's very, very useful. But that's the model that's used to allow teachers to be supported, so they can actually teach other people transcendental meditation, and they don't have to do something else to buy food and so on.
Thank you for that answer, Dr. Travis. And Naren, thank you so much. You are a living example. I've seen you when you were obese and losing 90 pounds, 35 kilos is amazing. CWC is an ecosystem of entrepreneurs, professionals, and health practitioners dedicated to cracking their wellness code by embracing evidence-based lifestyle, diet, and wellness best practices. CWC offers several programs, both online and offline. And you can visit crackthewellnesscode.org/all events to register for events of your choice. We have several events. We have events for seniors, youngsters, entrepreneurs, and also for local communities. And I'm glad to inform you that this is our 62nd online event since we were hit by COVID pandemic just a few months ago. So as you can understand, to continue a wellness movement of this magnitude, your generous contributions matter a lot to us. So I invite you to donate generously on crackthewellnesscode.org/donate. And by donating, you will not only help us run these programs effectively, but you'll also help us build content and work on digital projects that we use to support you. And on top of that, CWC is part of ICC, which is a nonprofit 501c3 organization. So you will also get tax credit for your donations. And I'm happy to inform you that this event is brought to you in collaboration with Thai Global, the world's largest entrepreneurial organization with over 60 chapters across the globe. So thank you for that. And with that, Dr. Travis and Dr. Gupta, thank you so much for staying almost 30 minutes extra. We really appreciate it.